Let's get the side of Department of Health. We have the DOH spokesperson and Assistant Secretary Albert Domingo on the line. Magandang umaga po sa inyo, Asec.
Magandang umaga, Gretchen, and magandang umaga rin. I know na done na siya, pero to a very good friend, Dr. Jose de Grano of Happy. Go ahead, Gretchen.
Okay, Asec, siguro we'd like to get your reaction to the numbers. I mean, 39 out of 43 hospitals in Batangas have not been paid. Help us understand why.
Yeah, Gretchen, I like how you said it. 39 out of 43 hospitals in Batangas. Remember, this is an isolated incident in Batangas. I think a lot of the traction that happened over the weekend is people thought that it was nationwide. So we are looking at, and Dr. De Grano is correct, there are human resource implications. There are reasons within our control which we are working on. But let's go straight to the matter. Bakit ba kasi nagiging guarantee letter pa yung transaction? So sinasabi nga namin, when you are at the Department of Health, we don't even need guarantee letters because the assistance is provided directly by a medical social worker.
What do you mean by this? I mean, na pagpasok nila sa ospital, dapat hindi nang hinihinga ng guarantee letter?
Yeah, because Gretchen, when you are at the medical social worker sa station, dun sa medical assistant na sinasabi, there is a registered social worker, a professional, CRC license, who evaluates the patient or the family of the patient as to economic condition. There should be no political consideration.
So we have waived already, the DOH has waived already the importance or the use of these guarantee letters in effect.
Alam mo, Gretchen, it's not even the DOH. I just keep on forgetting the name of the case, but there is a Supreme Court ruling that actually says when the budget is already within the execution stage or in the part of the executive, dapat talaga it's already like it's a procedural, kine-carry out na lang siya. Hindi na kailangan ng guarantee letter. So, yun ang medyo isang point na nako-confuse kami na bakit naging issue to. Kasi hindi dapat issue yung mga guarantee letters na yan by law.
Well, the hospitals cannot hold patients hostage because of that. But on the other end, mga ospital naman po ang magsasuffer kung hindi sila mabayaran on time ng gobyerno. Bakit po kaya may delay?
But Gretchen, again, I'll go back, no? Why are we even premising the obligation or the role, the task on a guarantee letter? Because like I said, the Supreme Court already said there should be no interference, if I may use the word, no? I think it's written in the Supreme Court decision. When it comes to the operations of the executive, pag medical assistance, dapat talaga registered social worker lang yung nagsasabi. At kung kailangan, because these are trained professionals, as we do in our DOH hospitals, then binibigay yung assistance.
Pero saan kaya nagkakaroon ng backlog? I mean, where is the hurdle in terms of processing these payments?
Gretchen, all processes have backlogs, whether it's PhilHealth, whether it's DOH, whether it's DFWD, and we all try to improve it. So it's not about trying to find the diagnosis. It's about going back to the principle. Why are we even dealing, Gretchen, with the concept of guarantee letters?
Pero under the MOA, the hospitals should receive payment within 60 days. Is that correct?
Yes, and Gretchen, who are the parties to the MOA? The parties are the Department of Health and the hospital. Diba?
Oo. So, in effect, itong mga delay, hindi po dapat nangyayari, di po ba?
No, it's not about a delay, Gretchen. I keep on bringing it back to the matter of, alam mo kung bakit pumutok to? Kasi guarantee letter yung pinag-uusapan. There have always been several transactions going on, and they are being addressed. I just wonder why the delays came out because of the issue of the guarantee letter that to begin with should be a non-issue.
So I guess the DOH will already settle its outstanding balance with hospitals of about like 480 million.
That's figure as of, I don't know what the reckoning date of Dr. Degrano is, no? But my staff tells me it's actually much lower than that. And again, these things happen all the time. Reconciliation, kapag tayo ay nasa tindahan, tapos sasabihin palista, siyempre may reckoning yan, may reconciliation. But again, it happens all the time. Pumutok lang to Gretchen kasi dun sa guarantee letter.
But would you have more information as to how long this balance has not been paid?
To our reckoning, it's only a matter of, I think, 1 or 2 months. And it's because of the volume that increased, particularly nung nagkaroon ng para bang mga requests over the March, April, or May period, yes.
Which is during the election season. Kaya nagkaroon ng worries.
Well, all I'm saying is March, April, May, Gretchen. The words came from you.
Okay, pero I mean, the 1 to 2 month period seems to be within reasonable time as it is within the 60-day period, no? Pero I guess ano po ang appeal po ninyo, no, sa mga publiko na natatakot na ngayon, hindi nila sigurado kung saan sila pupunta for medical services?
Okay. So wag po tayong matatakot sa lahat ng publikong nakikinig, no? Ang ating na pag-usapan nga po natin, 39 na ospital lamang po sa probinsya ng Batangas at hindi naman po lahat ito ng ospital. Marami pang ibang ospital. Otherwise, sa ibang bahagi ng Pilipinas ay tuloy pa rin po yung ating mga memorandum of agreement with the private hospitals. I'm sure as a PHAPI President Degrano, Dr. Degrano also acknowledges, it's only in Batangas at inaayos na po natin yung problemang yon. It's only a matter of processing and regular transactions po na matatapos. Meanwhile, kung may concern po ang ating mga kababayan, pwede naman pong pumunta sa DOH hospitals kung saan hindi kailangan ng guarantee letter.
Ibig sabihin dito po sa private hospital, technically, sa binabanggit po ninyo, hindi na kailangan ng guarantee letter. Sila ay dapat pumunta lang doon sa social worker assigned doon sa private hospital and they can get their treatment, just submit a proof of indigency and then leave the hospital after the treatment. Ganun lang po kasimple yun.
Yes, Gretchen. That is how we do it in the DOH hospitals. Of course, we can't control how the private hospitals run their shop. Pero we would recommend na dapat ganoon na rin sana. Use your medical social workers who are registered social workers under the PRC, no? Para yung it will not be sabihin na natin discretionary. It should be purely based on the financial capacity, as is the name of the program. Kaya nga siya medical assistance to indigent and financially incapacitated patient.
Okay, pero of course on the other side of the equation, yung private hospitals natin, I mean, we also have to protect their existence and their business. Kasi kapag dumami tapos hindi talaga sila mabayaran, paano po no, kung mag-downsize o talagang magsara? So what is the DOH doing on its part to be able to protect the hospitals?
Well, Gretchen, we are honoring our commitment. As I would like to highlight again, as acknowledged by PHAPI, the incident only involves 39 out of, it should not be 39 out of 43 nga eh. Ang denominator niyan, Gretchen, it should be 39 out of hundreds or maybe I think 1,000 or 2,000 private hospitals all over the country. The balance of which are all being attended to by DOH, and the 39, I'm sure they're also listening or watching, will also be attended to, and that is our commitment.
Okay. Pagdating naman po sa mga public hospitals natin at DOH-accredited hospitals, zero billing policy na po. Tama po ba? Ano pong ibig sabihin po niyan?
Yung zero billing policy natin na Gretchen, that applies to yung ating mga ward accommodation. Pag binasa natin yung Universal Healthcare Act, ito po yung ward or basic accommodation. But I would like to highlight, Gretchen, meron kasing para bang misperception na, ay nako, pag ward yan, pangit yan or hindi maganda. Alam niyo po, lalo na sa mga DOH hospitals, yung mga ward natin in-upgrade na, maraming sa kanila air-conditioned na rin at mas malinis na. Our public hospitals are in a much better state now than they were a few years ago.
So just for no hassle, if the patients want to get guaranteed medical care, they should head on over to a DOH-accredited hospital or a public hospital. But if they go to the private hospital and hindi po tinanggap yung guarantee letter, ay magsusumbong lamang sila sa DOH.
Yeah, pwede yon, number one. Or number two, baka kailangan para bang tignan natin yung prinsipyo ng universal healthcare. Kasi yung mga private hospitals, they are actually required by law to maintain 10% of their authorized bed capacity as sabihin na nating zero balance billing beds. Ibig sabihin, pag ang private hospital has 100 beds, dapat may 10 kama na no balance billing. We understand na pupuno po yun. Meron naman tayong transfer mechanisms na kung pwede silang i-transfer or i-refer ng ating private hospital papunta sa pinakamalapit na DOH hospital kung saan sasagutin namin sila.
Alright, maraming salamat sa paglilinaw po ninyo dito sa issue na ito, and it's good to know that the payments are happening and the patients should be taken care of. In the meantime, maraming salamat po for joining us today on Morning Matters. That was DOH spokesperson Asec Domingo.